um, the CDC is giving advice to the airlines now about cleaning. Uh, I personally was very happy that they were taking so many precautions and were doing the massive cleaning on the airplanes because they can be really gross when you get on the airplane. Um, are you sending mixed signals to the airlines and to folks who are traveling now that you've told them that they can step back and not do the amount of cleaning that they were doing before?
Well, um, I think we want to make sure we got to be careful about that. There are recommendations for cleaning, and then there's recommendations for disinfecting when you have someone in a home, for example. What we're saying is that without a doubt, respiratory transmission is the major modality of therapy, not touching something. That doesn't mean you don't clean it. You need to clean intermittently. You need to got to be make sure that, particularly if it's grossly soiled, you want to do it. But even if it isn't, you've got to clean occasionally. But you don't want people to be obsessed with cleaning and scrubbing everything, putting a lot of effort in. It is possible that it's spread that way, but the overwhelming modality of spread is through person to person, as
So,
opposed to touching something.
so on an airplane, you're in close quarters with people. They're not doing the seat between a person, an empty seat between a person anymore. And I mean, you can catch a cold on a plane. So what do you do when you're on an airplane? I mean, beyond the mask wearing, is there any other kind of
If
precaution you can take when you're on the airplane?
what, no, you wear a mask, number one, and the airlines have a pretty good HEPA filter system where they filter the air. So it would help, but when you see a picture of people sitting like this, that gets you nervous. One of the reasons why the CDC makes it very clear that right now, with this level of infection in the community, we should probably try to avoid travel if we possibly can and limit travel to what we would call essential travel.
Up until when?
Up until we get uh, a substantial proportion, the majority at least, of people vaccinated, and the level of infection goes very, very low. Everything is at the risk of the level of community infection. When community infection is high, and that is the 60,000 new cases per day that I mentioned just a moment ago, everything you do is going to be at risk if you don't have the kind of precautions that I'm talking about. That's the reason why you don't want to have theaters that have closed systems. You have limited seating at ball games. You have limited attendance at different events. When the level of infection goes way, way down, the risk is going to be less. You're going to start seeing greater capacities at ball games, restaurants having greater capacities, safer to fly. All those things relate to the level of infection. You bring the level of infection down, the risk goes down. The level of infection that's high in community, the risk across the board goes up.
I almost hate to kind of hammer on this, but I mean, people are planning trips for summer vacation, which require
Right,
flight or
right.
train or so if the levels stay the way they are right now, will it be safe to travel on the airplane?
It's all relative. It's all relative, the safety. I mean, right now, flying is because of the HEPA filter, because of the use of masks at the level of infection in community. It is a risk to fly, but it's a small risk. The more infection you get in the community, the greater the risk.
Okay.
So if we get more and more people vaccinated, by the time we get to the summer, the risk of flying will be even less than it is now. So I would hope, and I believe this is going to happen, that as we get the 3 to 4 million people vaccinated every day, so far 62 million people have been fully vaccinated. Over 100 million have received at least partial vaccination. You add to that 3 to 4 million people a day getting vaccinated. We're at April the 6th now. By May the 6th, 3 million times 31, you're almost at 100 million people who have now been vaccinated. I think that by the time we get to people wanting to travel in the summer, we will be much better off than we are today.
A lot of people pay very close attention to what you do, Dr. Fauci, and the choices you make to keep yourself safe. And I am very proud to say that I am a member of the House of Moderna, and I will be getting my second shot at the end of the month. They'll say something like, you know, I'll get on an airplane if Dr. Fauci gets on an airplane. It begs the question, when do you think you yourself, when are you going to fly? When are you going to feel comfortable to fly on an airplane?
Well, I'm not a good example. Let me tell you why.
Okay.
Because the nature of my job doesn't get me on a plane. I'm here. I'm locked into Washington right now for what we have to do here. So I would feel comfortable flying. You know, I'm vaccinated right now. If I had to do something that was essential flying, I likely would feel comfortable now being vaccinated to fly. I would. But since I don't have to, I'm not a good example. I can tell you if I have to go someplace this summer, like with the family, I would not hesitate to do that. If in fact we continue to come down on the infections and more people get vaccinated.
I think you just calmed the nerves of half of America just now.
Well, good. I'm glad I was able to do that.
Going back to some things that are actually breaking today, the Detroit Free Press has reported today that there were some significant occurrences with folks that are in nursing homes who've been fully vaccinated, with 3 of those folks who were fully vaccinated dying. Something that, you know, I've heard and we've been getting questions about, people think that once they get the vaccine that they're good to go and that they will never catch the virus. Can you talk a little bit about the chances of you catching COVID even after you've been fully vaccinated? And in the case of these 3 senior citizens in Detroit who passed away, unfortunately, after they were fully vaccinated, is it more likely to be a problem for senior citizens or for the members of the elderly?
You know, I think you just hit the nail on the head right there when you talking about it isn't unidimensional across all ages. If you look at the efficacy of vaccines, the efficacy against any kind of symptoms for the Moderna and the Pfizer are, 94, 95%. The efficacy against severe disease across all ages is about 80+%. The efficacy against death is very, very good. But as you get older and have underlying conditions, it is likely that the protection you get is not necessarily as good as the protection that a 30-year-old otherwise healthy person. So although those deaths are tragic, you don't want to see anyone succumb to this disease, be they in a nursing home or perfectly well outside. It is not totally surprising that you're going to see some cases of people who've been vaccinated who the infection broke through, particularly if it's in a variant that isn't as well covered by the vaccine. For example, the 117, which is the UK variant, seems to be pretty well protected against by the vaccine. But there are other variants, such as the South African variant, which is not as well protected. Doesn't lose all the protection, but the protection goes down somewhat. It is likely that the New York variant and the variant from Brazil loses some of its potency, the vaccine potency when you get infected with that. So there are a lot of complicating issues. So even though we should not start worrying that the vaccines aren't protecting us, nothing is 100%. That's the thing you've got to realize. Nothing really is 100%. So you're going to start seeing breakthrough infections. You shouldn't get discouraged by it, but you shouldn't be surprised by it either.
So, speaking of how long a vaccine lasts, the protection of a vaccine, we heard that for Pfizer, it's 6 months after. It's really good, still really good. How are you following up, and what are you looking at in terms of the possible need for a booster shot? Because, I think of this like the flu, right? I mean, no one has to get a booster shot when you get the flu. You get a flu shot and, there's no booster, but we're hearing about the need for possible booster shots later on. Yeah, go ahead, hit me.
Careful. I'm going to hit you.
Hit me.
You get a flu shot every year.
Right.
That essentially is a booster in some respects.
So will we be getting a COVID vaccine every year like we get the flu?
It's possible. It is possible. See, you get a flu shot every year because the virus changes a bit. It drifts. So just to be precisely correct, it will save me hundreds of emails if we get precisely correct. So let's zing on the correct thing here. When you're talking about durability, that means if you get an immune response against a specific virus, and over time, if nothing else changes, it is conceivable that the level of protection goes down and down and down until you get a certain level that isn't quite protective. You need a boost to that same virus. That's the classic boost. So what you're saying is we know it lasts for 6 months because we've only looked for 6 months. It could be 8 months, a year, 2 years, 3 years, we don't know. So what we're going to do is we're going to follow people to measure the parameters of immunity to see how long it lasts. If it lasts way out, we may not have to boost it. If it starts coming down, we may need to boost it. Now, to be precise, there's also the issue if a variant comes in, which this particular vaccine doesn't cover as well. Same like flu. You get one kind of flu this year, you got to get vaccinated next year, not because the immunity didn't last, is because the virus changed. So it is conceivable that in addition to the duration of the immunity, if you're dealing with variants of the SARS-CoV-2 that actually change, that might be another reason why you got to come in with another shot, either a shot against the original one or a shot against the new variant. Bottom line is you pay attention to what's going around, you measure the level of immunity, and when you need to boost it up, you boost it up.
So you just gave me like a whole nother set of questions. You know that, right?
Of course.
Whole nother set of questions. And some of these questions may seem rather simple, but we're taking them from the listeners. Ordinary people have questions that, might not be asked in science, okay?
But they're important questions.
Yes, they are.
Anybody.
So, if you get your first shot of Pfizer or Moderna, does it matter if you don't get the second shot with the same vaccine? Or is it even possible for you to get like the first shot of Pfizer and then go back and get a second shot of Moderna, vice versa?
Okay. That has not been studied to give a definitive answer.
Okay.
However, given that they're both mRNA virus from mRNA vaccines, since they're both mRNA vaccines, conceptually, it just makes sense that it shouldn't be much different by getting a Moderna followed by a Pfizer, even though the studies have shown that you should get Moderna followed by Moderna, Pfizer followed by Pfizer. We're now looking at to see if there's any difference if you do one followed by the other. Why are we doing those studies? We're doing those studies because human nature tells us that people will get one and either forget, lose their card,
Right.
not know which one they got, and go and say, I know I got the mRNA, but I don't know which one. That's why we're doing a study to see if there's any difference. I would predict that there's not going to be any difference between the same two or one followed by the other.
I doubt they're going to say, I know I got the mRNA, because they're more likely to say, I got the Fauci ouchie or something like that.
Right.
So,
Right.
and speaking of which, can we talk a little bit about what is going on with AstraZeneca? All of the stories about clots and everything. What's going on with that vaccine?
Okay, what I would recommend, you're absolutely, you are hinting that there's a degree of confusion here.
Indeed.
And your hint is on the money, because there is. The easiest way to get this settled is that AZ will be and are in the process of submitting their data to the United States Food and Drug Administration to apply for an emergency use authorization. The FDA, our USA FDA, meticulously goes over all of the data in a way that no other organization does. When they come out with their decision as to an EUA or not, then I think many of the questions that people are asking about the possibility of clotting, adverse events, how effective it is or isn't, those questions are going to be answered. But you're right, up to now, there's been a little bit of a confusion about that.
What can you tell us about the Novavax vaccine? You had that up in your presentation just a little bit for like 10 seconds. What can you tell us about that vaccine, and how does it measure up to the other vaccines in terms of efficacy?
You know, the preliminary data that we saw from the UK and South Africa actually looked quite good. It was approximately 90% efficacy against any clinical disease. The efficacy against severe disease, there weren't enough people in that particular component of the trial. We are going to be doing, as we've said, we're going to be taking a look at those data when they come, you know, for us to look at in the United States, likely by the end of April, the beginning of May, and we'll get a good feel. But what I saw, I was quite encouraged by.
What about the vaccine in a pill form? Because nobody likes to get a shot, but we're hearing about the development of pills. What do you think about that?
I think orally administered vaccines certainly are promising, particularly since they tend to immunize the oral mucosa and the mucosa as opposed to, you know, systemically in the muscle. That some orally administered vaccines could have an even greater effect than the intramuscular administered, but we don't know that yet. They're being studied. So there is not right now, nor will be there in the immediate future, an orally administered coronavirus vaccine, even though there are laboratories that are working on it.
Okay. A question from Marilyn Marchione at the Associated Press. What can we do now to better prepare for the next pandemic? And what do you see as the biggest gap or the need in terms of treatment for COVID-19?
Yeah, let me answer the second question first, because that was one of your questions.
Right.
And I had 2 slides on them. So it could tell Marilyn, if she was watching my lecture, instead of looking at something else, she would have gotten it. Just kidding. Marilyn's a friend. Actually, the real gap that I'd like to see filled is an orally administered direct antiviral agent that can prevent people who present with symptoms from progressing with symptoms. And and getting to the hospital. So that slide that I said, targeted antiviral, looking at the vulnerable points in the replication cycle of the virus, so we could have an orally administered medication very similar to what we have for HIV and for hepatitis C. That was the second question. What was the first question?
Well, actually, I'm going to change the first question. So would you say that that is your top priority for improving treatment?
Yeah, I do. I mean, myself as a virologist, immunologist, I believe that if you look at the spectacular successes with anti-HIV medications and hepatitis C, to get a good, potent, orally administered drug that as soon as someone presents with symptoms that clearly looks like COVID-19, give them 7 or so days, 7 to 10 days of a drug, and they'll be done without progressing onto the serious consequences.
So are we looking at, are you looking at something, are you talking a little bit of something like when you have to take like prednisone or something like that, when, you know, the doctor gives you...
Prednisone is different, see, because prednisone, again, I know I went a little fast and I apologize, but you can look at therapies of two types, those for early to moderate disease and those for severe disease. Early disease is directed predominantly against the virus itself to prevent the virus from triggering these aberrant inflammatory and immunological responses that later in the course of disease are likely the cause of severe disease and death. Dexamethasone or steroids, they are used to block inflammation and are quite good when you have advanced disease, either requiring a ventilator or high flow oxygen. You want to dampen the inflammatory and the immune response because it's overactive. You don't want to give that drug early because early you want the immune system to fight the virus. So you want to give the anti-inflammatories late in the course of disease and direct antivirals early in the course of disease.
Okay, we're getting so short on time. I could talk to you for 2 hours. As a public health measure, do you expect vaccine passports to be required around the world? I know I'm going to Aruba this year, and they're already requiring that I get their insurance when I come into the country, which I'm going to do. But I mean, wouldn't it be great if I just had a vaccine passport? Is that good?
So you're going to Aruba. That's the reason why you're asking about flying.
Absolutely.
Huh?
It's all about me.
You know, when you say required, that's an interesting word. I can tell you that there's always talk about verification
right.
Of vaccination. That almost certainly, to some extent, is going to be done at the local level, even in our own country, but even more likely when you want to go someplace in a foreign country, similar to like a yellow fever vaccine card that you get and you can't get into Cote d'Ivoire or Liberia or places like that unless you have that card. It's not going to be federally mandated. I'll guarantee you. I would be very surprised if the federal government, our government, ever made a decision that you have to have a vaccine card to go any place. But what you might see is individual entities like theaters or ballparks or other places saying, you know, I'm sorry, I want to see some validation or I won't let you in. It's perfectly within their right to do that if they want to. I mean, I'm not sure that's going to happen, but the one question we always get asked is the federal government going to make those impositions? And that I almost can guarantee you is not going to be the case.
I need to ask one more question before we get to our close, and I don't want to leave off parents who are concerned about their kids getting vaccinated because that's an issue. How soon will we know if vaccines are safe and effective for children that are 1 to 12 years old? And I know that there are some tests that are going on, and we've seen reports of it. Can you talk a little bit about the trials that are going on in children?
Yeah, well, there's already a trial in adolescents from 12 to 15 shown to be 100% effective. There were 18 cases in the placebo group and none in the vaccine group. A couple of companies, including Pfizer and Moderna and others, are doing what's called age de-escalation studies. So you look at, you don't want to jump and get all the kids together. You want to gradually work your way down in age, because the younger the kids are, the more vulnerable they are. So, for example, an age de-escalation study would look at children 12 to 9, then 9 to 6, then 6 to 2, and then 6 months to 2 years. By the time we get them all done, we think it'll be ready. We think it'll be ready to give it to children no later than the end of this year and the beginning of the first quarter of 2022.
Okay. Well, before I ask the final question, let me take a moment to thank the organizers of today's event. Headliners, co-team leaders Donna Linewan and Lori Russo. Today's headliner event coordinator, Bill Pierce. Club Communications Director, Lindsay Underwood, and Club Executive Director, Bill McCarron. I'd also like to tell you about some upcoming Press Club headliners. On Monday, April 12th, we'll hear from Washington Post reporter John Woodrow Cox, author of Children Under Fire, An American Crisis, on the impact of gun violence on children in America. And on Tuesday, April 13th, we'll hear from award-winning CBS journalist Marvin Kalb, who will share the second volume of his personal memoir, Assignment Russia: Becoming a Foreign Correspondent in the Crucible of the Cold War. And we hope you will join us. So we've had a very serious hour, Dr. Fauci. Would you agree?
I agree. It's a very serious issue we're dealing with.
It is indeed. But people love you and people hate you. So talk a little bit about how it was working in the Trump administration. That's right. Yeah, people love you, people hate you. How was it when you were there? I mean, when you were on the CNN interview, you know, you were very forthcoming, but talk to us about the pressure you were under.
You know, to be honest with you, I don't like to do that. The reason is, let me explain to you why.
Okay.
The reason is that if you keep, you know, rehashing all of that, you know, if you keep rehashing it, it creates a degree of hostility with the very, very, very many people who still are loyal to Trump.
Okay.
And, you know, if you say anything that's even slightly negative, you wind up distracting from what we all need to do right now. So rather than look at how difficult it was or was not back then, I really want to use all of my energy to look ahead about how we can end this under what we're going on right now. So I'm sorry for pulling away from what,
I had to ask you that. You know, if I didn't ask you that, people would take me to task, right?
Yeah.
So
there are so many more important things to do than go back and rehash that.
That is true. You've received a lot of accolades during your career for your achievements in public health and virology, but it took until 2020 for you to merit your own bobblehead. How do you feel about that?
You know, it gets back to what you just said a little bit ago when you were asking me the question. Yeah, it took until 2020 to merit my own bobblehead, but it took until 2020 to require federal agent protection for me for people who threaten my life.
Amen.
So, you know, it's a strange world.
It is indeed.
It's a strange world.
What do you do to decompress, Dr. Fauci?
Well, I used to run. Now I walk really fast. So I exercise every day. That's the one thing I do. I do it with my wife generally in the evening and on the weekends during the day. But that's the one thing that I still love to do to decompress.
Well, we really appreciate you taking care of yourself and taking care of all of us throughout the country. We appreciate your guidance and we appreciate your time today here at the National Press Club. You know, we usually have you in person and we usually have some cookies ready for you and have you at the head table, but this was fantastic. Thank you so very much for your time today, Dr. Fauci.
I appreciate it. Thank you for having me. It's always good to be with you. Look forward to doing it in person sometime soon.
Absolutely. Thank you.
Take care.